when a 56-year-old farm worker from the outskirts of Kansas City, Missouri, U.S., saw a rash on his waist and arms within hours of eating a hamburger 7 years ago, he was at a loss for what to do. As is the case with many persons who have alpha-gal syndrome, AGS, the link between a tick bite and a meat allergy has not been established. After all, the rash and urticaria did not always emerge following a meat-containing meal. Alternatively, it may appear numerous times in a single week. On rare occasions, I experienced shortness of breath, but nothing severe enough to justify a visit to the doctor. It was recently summarized in the medical journal BMJ Case Studies in this particular situation. Seasonal allergies and the HIV therapy he got at the age of 21 compounded the patient's background. For years, he reported his symptoms to doctors with no progress toward a definitive diagnosis. Changing the detergent made no difference. They were not dressed in fresh clothes. Regrettably, food allergies were first ruled out, as symptoms typically manifest within minutes, not hours, of consuming the food to which you are allergic. His is not an unusual story. In some locations of the United States, nearly 3% of the population has been reported to have some form of symptom related to AGS. However, we still know very little about its prevalence. For a condition that has surely existed throughout human history, it seems incomprehensible that researchers started examining it in depth less than 2 decades ago. Thomas Platts-Mills, a British-born allergy researcher, first brought attention to allergic reactions in cancer patients treated with the cancer medication cetuximab in 2002. While he had seen individuals who claimed to have an allergic reaction to specific meats and animal products, the connection between the two was the furthest thing from his mind at the time. Years passed, and serious cetuximab responses were documented throughout the United States. Finally, in 2008, Platts-Mills found the underlying source of the disease, an IgA antibody reaction to galactose alpha-1,3 galactose. Or simply alpha-gal. Alpha-gal is a naturally occurring sugar present in a wide variety of species. Primates such as ourselves are an exception. Sugar was transported from genetically engineered mice used in chemotherapy in some way. Allergies are typically triggered by the body's immune system reacting to a protein it does not recognize. Consuming carbohydrates that could cause allergies was quite unusual. After resolving this conundrum, the question of how people developed allergies in the first place remains. There were few indicators. One was the case pattern, which was strikingly similar to that of Rocky Mountain spotted fever, a disease spread by lone star ticks, Amblyomma americanum. The second occurred as a result of a chance meeting with a fisherman who had had a severe allergic response to meat. Platts-Mills inquired about the man's tick bites, and he was suspicious. He certainly possessed more than his fair share. However, it was his personal experience with the condition that convinced the researcher. Platts-Mills urgently wanted to disprove his disbelief and took a walk in the nearby mountains to check if he could not capture some ticks on his own. Later that year, a lamb chop lunch elicited an all-too-common allergic reaction. Today, scientists are convinced that it is the alpha-gal molecule coupled to the proteins in tick saliva that causes people to develop sensitivities to carbs found in lamb and beef. Because heating does not degrade them, our bodies react angrily when they enter our system. In the case of the farmer whose condition was recently revealed, he eventually found physicians who identified his ailment. 7 years after exhibiting symptoms for the first time, a friend informed him about AGS. Due to the fact that ticks are a frequent hazard on the workplace, the patient made contact quite fast. With an EpiPen in his pocket and red meat off the menu for 8 years, the patient has been relatively reaction-free. It's a happy conclusion from which we can all learn. AGS is a relatively new condition in terms of study, which means that there is still much to learn about its prevalence and relationships with other diseases and therapies, including potential interactions with medications and their components. If you have the impression that something is not quite right following a burger, discuss it with your doctor. 8 years of sweating is not worth it. The case was described in detail in BMJ case reports. Thanks for watching. Please like and subscribe.